understanding about these conditions in the medical profession results in many people having their symptoms dismissed by doctors.
How do doctors treat something that they don't understand themselves, or that they're not actually educated about throughout their study?
Recently, like within the last year, two things that have been said to me were, you'll grow out of it and maybe you should just wait and see if it gets better. After 10 years of being sick, that was ridiculous and extremely insulting.
Because they're basically implying there's nothing wrong with you and that you just want drugs, when actually I really don't enjoy being on painkillers. They're horrible.
I got diagnosed with a UTI.
Really?
I said to the doctor, have you ever had a UTI? It's not a UTI.
I was in hospital having renal colic because kidney stones, and I was told I was having a panic attack.
Oh yeah.
Calm down, you're having a panic attack.
I'm just pulling my hair out going, of course I have anxiety. You're not listening to the thing I'm saying.
Yeah.
I think stress and anxiety and the psychological somatic type issues are we're throwing those cards a lot. I think maybe because it's easier and a lot of them don't really know what's going on, and we're probably in a too hard basket.
For me, I went as a first point of call to my GP that I'd been seeing over the last few years, and he said to me that it's depression.
Yeah.
You might not, I was saying that, I wasn't sad, I wasn't upset, I wasn't anything like that. My brain just wasn't working. And he's like, oh no, you're depression, you're just too stressed.
Yep.
But I just knew something else wasn't quite right.
I've had trouble with depression prior to this chronic fatigue syndrome. For a long time, the doctors and the psychologists were saying, oh no, you're just depressed, it's just depression. Depression causes low energy, depression causes trouble sleeping, depression causes gut issues. And that's all true, but I knew that what I was feeling was different to how I was feeling with depression.
Told by very top level that I had conversion disorder, which is serious psychological issues then leading or causing fibromyalgia.
I think my most common misdiagnosis was just being told that I was healthy. I really struggled to get diagnosed with anything, basically. And the other thing with the chronic fatigue syndrome is once I did get a diagnosis, well, there wasn't actually anything that the doctors could do. I wasn't put on any medication, I didn't particularly have a treatment plan. It was just like, oh yeah, okay, you do have chronic fatigue syndrome. Good luck with that.
I couldn't write, and I was very much having trouble speaking, breathing, walking. Yep. Everything was very difficult, and it wasn't taken seriously, and it's terrifying that you can't speak and you're hysterical to the doctors, because there's no way you can advocate for yourself in that situation. When I was so sick, I couldn't possibly have advocated for myself. I needed support, and that wasn't given any.
9 out of 10 people who have fibromyalgia are female. Likewise, 7 out of 10 people who have ME/CFS are female. Historically, when a condition mainly affects women, it is more readily dismissed and it's often labelled as hysteria.
Yeah, I definitely think being a woman is part of it. I think that my pain gets disregarded.
You find a lot of women are affected with chronic pain. I think it was about 85% statistically. And when that is known, a lot of specialists, especially male specialists and GPs, I find go for a psychological anxiety, stress, distress diagnosis, hysteria. So I personally think the emotional card is thrown at us, possibly because we're women.
I've been treated as hysterical frequently, many times, yeah.
But there are studies that now show that women's sort of physical pain and symptoms are dismissed more readily than men. Women have to wait longer in emergency for pain relief medications.
Yes, and I've been treated so poorly in hospital, just basically put off to the side and ignored until things got really bad. Like, I have been in the hospital with a kidney infection, and I knew I had a kidney infection, and I told them that, and they just ignored me. I was asked if I was on my period.
That's the assumption that women are weaker and have a lower
Lower
pain tolerance.
Yes,
Yeah,
and
so,
I honestly think I have the highest pain tolerance of anyone I know.
Yeah.
Like,
And that we're more emotional. So,
Yeah.
yeah,
Yes.
which all ties into the history of hysteria and
yes, and if you cry,
yeah.
it's all over then if you cry.